You might be sitting there thinking, I'm wondering if I should have an induction, and you're wishing that somebody could kind of go over the pros and the cons with you so that you could understand a little bit more about what you'd be expecting from an induction. And today I'm going to go over all of those things. And as someone who has seen thousands of people get induced, including one induction of my own and one augmentation of my own, I really can speak to a place of experience that I think will really help you out. And yes, that's right. Even knowing all of the pros and cons of an induction, like I did choose induction for myself, but I think it's so important to know what to expect as you're going into an induction, which is why I created my free induction checklist that you guys should check out down below. Really quick, I think it's important to go over kind of the history of inductions. And as someone who's been in the labor room since 2001, I can speak to the fact that back in the day, prior to about 2015, providers were able to induce for pretty much whatever the heck they wanted. And then hospitals started instilling something called Leapfrog codes that a provider had to give us a specific diagnosis to have a patient induced prior to 39 weeks. And so that is why if you're wanting to get induced prior to 39 weeks, you have to have a specific diagnosis that your provider gives so that we can induce you in the hospital. And I gotta say, I had people who were just electively getting induced at 34 weeks. So having those Leapfrog codes, I think, is an important thing because we do know that it's important that babies stay in and cook as long as they possibly can. Okay, let's go through the pros first because I love to keep things positive. The first one is that the baby comes out and you are no longer pregnant. Now, a lot of you may be focusing on this. You're 39 weeks pregnant and you are just tired. You're miserable. Maybe your pelvis is splitting or who the heck knows, you're just done being pregnant. And so the pro of an induction is that your baby comes out and you are no longer pregnant. Side note, if that's you, you need to weigh the pain of an induction. Sometimes those types of inductions can be really long and people just aren't expecting it. And ultimately they decide that they probably would have rather stayed pregnant for a little bit longer, let their cervix ripen naturally through time, and then have their baby later on. So that's something to think about for sure. And I'm sure I'm going to talk about that more in the cons, but I love to give that side note here so that you understand. One of the other pros is possibly healthier babies. You will hear OBGYN say nothing good happens after 40 weeks. Sometimes it's 41 weeks, sometimes it's 42 weeks. But the idea is that your risk of a stillbirth starts to dramatically increase after about 40 weeks of pregnancy. Now, 40 to 41, it's a small increase, but as we get to 42 weeks, it is a dramatic increase because your placenta really just has a shelf life. And it stops giving baby all the good blood flow that it needs. And so that is why after 42 weeks, they really want to see baby be born. Now, in the ARRIVE trial, totally controversial, they decided that it was better for babies to be born rather than to wait for labor at 39 weeks of pregnancy. I don't know that the study actually showed that, but it did show that a 39-week elective induction is pretty darn safe, so you can take that away from it. And I actually have a deep dive of the ARRIVE trial in the online prenatal class for couples for people who are considering an elective induction, just so you can understand what the study shows. I'm going to put the link for that class down below. And while we're here talking about this, please remember that your due date is plus or minus a couple of weeks, which is why they chose 39-week elective induction, because that shows that at least your baby is at least 37 weeks, we hope, and less than 41 weeks. So that's how they kind of came up with it, that you could choose to be induced at 39 weeks. One of the other pros for an induction is that you can schedule it. And as someone who got induced on my last baby, it was really nice to be able to drop my kids off at the sitters, say goodbye, have a really nice moment with them, and then go to the hospital versus the whole, do I need to call somebody? What's going on? Which I had experienced during the weeks prior to having my baby and with my other kids. It's just nice to be able to schedule it. A lot of men like to be able to schedule it around their work life. So that's something to consider. It might be worth it to get induced just so that you can schedule it. And that's fair. As I'm talking about this, you'll hear a lot of people online saying that you shouldn't have any elective inductions. We should never induce people. And I'm here to say that it is up to you as an adult. You can weigh the risks and the benefits, and the benefit of scheduling it might be more than the risks of having an induction. So be sure and also check out my video on if you are ready to be induced, because that changes things a lot. I'm going to put the link both above and down below so you guys can watch that one. Are you thinking of having an induction? Tell us down in the comments what pro con is most important to you. Okay, let's talk about the cons of an induction. Now, most of these I'm talking about cons of a 39-week elective induction, but these do mean something also if you're being induced for something like diabetes or baby's too small or things like that. Again, you're weighing the risks of baby staying in with the benefit of baby coming out. The same way someone who's having an elective induction is weighing their own risks and benefits as well. The main con to having an induction is that it takes longer. Even in the ARRIVE trial, which showed that it might be safer to have a baby electively induced, it did show that people were in labor longer. Now, I wish that that trial sort of stratified it out according to what your Bishop score is. Again, I talk about the Bishop score in that Are You Ready to Be Induced video that I'll put the link down below. We do know that inductions, when you're not in labor at all, take longer in the hospital, especially. Remember, you're starting labor in the hospital with an induction versus when you come in active labor. Hopefully you've labored at home and had some good times eating some brownies at home, even though you were contracting, so you spend less time in the hospital. And for a lot of you, you absolutely hate being in the hospital. That was one of the reasons that I didn't want to get induced. And that may be a real con for you. So it's something to consider. Now, some of you may love being in the hospital because we're monitoring the baby and we're really taking care of you. And again, that might be a pro for you as well. Now, some people think that there are poorer baby outcomes with an induction of labor. Again, the ARRIVE trial didn't show that, but there's always the concern that your due dates are a little bit off, baby's a little bit early, baby gets contracted on a little bit too much, and so you end up having a C-section, things like that. There are some risks to baby that it's important that you talk with your provider about ahead of time. Now, there is an increased risk of having a C-section if you are induced. The studies definitely show that. Now, when we take those kinds of studies, you have to remember that most people getting induced, or a good number of people getting induced, are doing so because they have some high-risk issue with their pregnancy. Again, baby's too big, baby's too small, they have diabetes. Now, those people are at a higher risk of having a C-section because baby may already be a little bit compromised when they go in for labor. So it's just important to take that into account when you look at the studies of an increased C-section with an induction of labor. I will say the ARRIVE trial, which only had low-risk people who didn't have any problems with the baby, they did not show an increased C-section rate with that study. Again, wildly controversial, but it did narrow it down to just people looking to make the choice to be induced versus people who may have already had complications with their pregnancy. With an induction of labor, you always have the chance of an adverse drug reaction or an adverse reaction to whatever we're putting in there, because there is a Foley bulb induction, which if you're interested in the information about that, I have a whole article. I'll link to that down below. By the way, this video is taken from a whole article, and I'll link that article down below as well. But because we're putting things inside your body, there's always a chance that you'll react poorly to that. And a lot of people just don't tolerate the Foley bulb induction well, adverse reaction or not. They find it extremely painful. And yes, it's super weird that some people we can put it in and they're like, cool, I'm fine. And some people we put it in and it's wildly painful and they want it out immediately. And it's really hard to know which one of those people you are going to be. There's other drugs like Pitocin and misoprostol that we're using that you could have an adverse reaction to as well. And I think that's important to know and why it's part of an increased risk. And all of these things are a reason that an induction does have a higher risk at the hospital, and it's why we require monitoring and usually IV access if you are being induced. Now, one of the things that is kind of hard to quantify is that inductions are more medical. Again, if you hate being in the hospital, it's just more medical stuff. Now, some people don't mind that at all. Again, everybody's different, but I think it's important to know that there's going to be more wiring, there's going to be more IV tubing, things like that. So you just need to know that ahead of time. If you are planning on a home birth and you really just want things very, very natural, then an induction may just be too medical for you. Now, using Pitocin has been shown to increase your risk of postpartum hemorrhage. And the reason that happens is because we shower your uterus with Pitocin during an induction of labor. We're putting more Pitocin than your body would make naturally. And when the chips are really down, we need that uterus to contract so that you don't end up bleeding out. Sometimes your uterus is already full of Pitocin, so it just doesn't have any more to make it contract harder once the baby is out. In case you didn't know, once baby is out, your uterus has a placenta-sized scab on it, placenta being about the size of a dinner plate. and it has to collapse back down on itself to prevent you from bleeding. And Pitocin is the way that Mother Nature makes that not happen. But if you've had an induction, we've already put Pitocin in you, so you do just have an increased risk of postpartum hemorrhage, especially if you've had a really long induction. It's something that's good to know about. Sometimes with those types of inductions, we'll already have postpartum hemorrhage agents waiting in the room just in case, because we know that it does happen more frequently. I've also seen online people talking about an increase in postpartum anxiety when Pitocin is given at delivery. The big problem being that Pitocin is a standard of care after you have your baby, and we're giving you a whole lot more than we give you in an induction of labor. Most often when you have your baby, even if it's not an induction, we have a bag of Pitocin that we give you through your IV right after the placenta comes out to make sure that that uterus clamps back down and you don't have a postpartum hemorrhage. So when they do those studies, I'm like, who is not getting Pitocin after delivery? It's not a whole lot of people. I would say that 99% of people are okay with getting it after delivery to prevent the postpartum hemorrhage. So when we make studies like that, it's a little bit confusing because it's not just people getting induced, it's most of the people. This is a quick reminder that there is not one right way to birth. Everybody has different things that they want in their pregnancy. Everybody prefers different things. Just like I said, some people love being in the hospital because it feels more controlled to them. And some people hate being in the hospital. So you have to understand what's important to you. I think that creating a birth plan can be really helpful for that. I'm going to put my link for a birth plan down below for you. But if you're really looking to get prepared for all of your birth, I have a whole induction chapter. Come join me in the online prenatal class for couples. We're going to get you prepared for third trimester, labor, birth, postpartum. I'm going to put the link for that down below as well. Okay, one of the most important things in this is what your cervix is telling you. It's really going to help you know if your body is ready for labor. I'm going to put the video up above for that because I think it is so important to review with your provider before you decide if an induction is right for you. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.